All right. So good afternoon, everyone. Thank you guys for joining in for the Fairfax County Veterans Collaborative. I'm Christy Kennedy, one of the chairs for the meeting, and my co-chair is Michelle Cole. Are you there, Michelle?
Yes, I am. Hi, Christy. How are you? Hi, everybody.
Good afternoon. Good to hear your voice, and thank you for joining us today.
Thank you.
Awesome. Well, as we get started this afternoon, we'll kind of do our normal kind of round robin, let everybody kind of introduce themselves, give introductions so everybody knows who's joining the meeting this afternoon. And then after that, we have two presentations lined up. One is with In Transition program with Brenda Campbell. And then we also have Jennifer Mayers from Freddie Mac, who will be talking about a new initiative that they have. So excited to have them on board. And then also Richard Lane will be here to kind of talk briefly about his work with the program with Freddie Mac from Legal Services of Northern Virginia. Right, so with that, we'll kind of just start with introductions. Obviously, you know, if you can let us know your name, your organization that you're with, and how you're doing right now. I know that, you know, with everything that's going on in this world with coronavirus and the hurricane that just blew through and more, we want to check in on you, make sure that you guys are doing okay. So let us know how everything's going. And if you have any updates and announcements, we will be going through those after our presenters today. So, so feel free to hold back any updates and announcements. We can share those at the end as well. So I'll go ahead and start. I'm Christy Kennedy, the Senior Manager at Serving Together, a program of Every Mind. I have been with the organization for 4 years now. I'm a military spouse, very passionate about serving in the military and veteran space. I do a lot of work in the region to coordinate these collaboratives, but also connect our military veterans and their families to area resources like yourselves. And aside from that, I also am in charge of our education and training programs. So I'll be sharing you guys some more information about some upcoming events we have after our presenters today. So with that, I do want to turn it over to my co-chair, Michelle, if you want to go ahead and introduce yourself.
Hi, I'm Michelle Cole. I am a spouse of a Navy veteran and the mother of an active duty Navy submariner. And my organization is MK9 Service Dogs, and I'm the Director of Operations and K9 Programs. We provide service dogs to veterans with physical and or mental health disabilities at no cost to the veteran. And we're doing well. My husband actually had a negative COVID test, so he's moving forward to having a knee replacement on Friday. So that's my big news.
Well, prayers for him that the surgery goes well. I'm glad to hear that he had a negative COVID test.
Yeah. So was he.
Some thumbs up.
Yeah. He was very happy this morning when he got the results.
Good, good. We'll hope that everything goes well with the surgery and that he recovers as quickly as possible with that kind of surgery.
Well, thank you.
Awesome. So I'll just kind of go round robin across the board who I see next. So you have each a little bit of time to introduce yourself. So the next person I see is Yolanda.
Hi, good afternoon, everyone. Can you hear me, Christy?
Yes.
Wonderful. New headset, so just test driving it. My name is Yolanda Rayford. I'm the Senior Career Coach with Easter Seals Veteran Staffing Network. Easter Seals is doing well. We have been running full strength with the onset of the pandemic. I'll give an update at the end at Christy's direction, but Easter Seals Veteran Staffing Network supports veterans, caregivers, transitioning military service members of any era. We place job seekers nationwide in a variety of industries. And my role as a senior career coach is to provide one-on-one virtual job seeking services for anyone who is in need of them. And so I'll give more information at the end. But negative COVID test, I have a story to share. I just met my granddaughter over the weekend who was born at the height of the pandemic in New York City.
Wow.
So yay, I'm so excited. Everybody quarantined. We did all the wonderful things. And Yes, I'm a grandma yet again, and it's always good to smell a baby, if you know what I mean. It's amazing. So thank you, Christy.
Yay, so glad you got to meet the grandbaby. That's awesome.
Thank you.
Awesome. Bob Bent, are you there?
Yes, I am. Good morning, Chrissy.
How are you?
It's Bob Bent, and I'm a retired military officer from the United States Army, and have been associated with the Disabled American Veterans, a veteran service organization here in Virginia for several years. I stand ready to assist veterans and family members with issues that they may have with the VA.
Awesome. Thanks, Bob. I'm glad you're here and hope you're doing well.
I'm fine, thank you.
Good. Jay Kellner.
Hi, everyone. I am president of Vietnam Veterans of America Chapter 227. It's the largest chapter in the state with 326 members, the Vietnam Veterans of America. Nationwide, we have over almost 87,000 members. Our credo is never again will one generation of veterans abandon another. And we continue even during this pandemic to help out veterans, not just Vietnam veterans, but veterans of all recent conflicts as well. Most recently, we donated $1,000 to Capital Caring Health. They run a large operation of hospices and services for people who are confined there. And they have started a new program, prescription meal delivery, food deliveries to people in hospices. And we contributed $1,000 to the veterans who are in that the situation. And we're still meeting every month as a board, and we have a general membership meeting usually every month. And so we're trying to, even in this era of virtual meetings, to keep our operations running. And we've been successful so far. Thanks.
Yeah, good to hear from you, Jay. Thanks. Michelle Palmer.
Hey everyone, my name is Michelle Palmer. I am the Vet Success on Campus Counselor with the Department of Veterans Affairs, and I split my time between Northern Virginia, Annandale, and Alexandria. And the Voc Rehab program has had a name change, so they are no longer Voc Rehab and Employment. They are now Veteran Readiness and Employment. So still VR&E, just a little bit different. Take the focus off Voc Rehab and more on veteran readiness and getting them ready for employment.
Awesome. I heard about that name change. That sounds great. Thanks for being here, Michelle. All right. Richard Lane, are you there?
Yeah, I'm here. How you doing today?
Do you mind?
Yeah, my name is Richard Lane with the Legal Services in Northern Virginia. I am a Navy veteran. We provide civil legal assistance to low-income residents in Northern Virginia, and the project I work on, which is a veterans law project, is working on discharge upgrades and now aid and attendance for VA pensions as well.
Awesome. Look forward to hearing more about that. Maria Jose Cantoni?
Antoni, yes, you did it. Hi, Christy. Good afternoon, everyone. Thank you for having me today. My name is Maria Jose Cantoni. I am the director of the Financial Empowerment Center at the South County in Alexandria. We provide financial coaching opportunities for clients to be able to put their finance together and move forward. We provide a lot of services. Right now, we have been working online since March, and we're still doing that, working online through phone calls, video conference with our clients, and it has been working very well, I must say. We were a little hesitated at the beginning, but I think this is the best way to provide the service to our clients, be connected in a safe way for everybody. So I'm glad to be here.
Awesome. I know, Marie, it's been very interesting being virtual, but it's hopefully, I'm glad to hear it's working out well for your team. Dina San Juan.
Good afternoon, everyone. I am Dina San Juan from the Virginia Department of Veteran Services. I am a veteran service representative for over 3 years now, or 3.5 years now. And we are a state organization who helps veterans file claims to the VA. And there are 34 offices throughout the whole of Virginia. Thank you.
Awesome. You're doing well, doing okay during all this?
Oh yeah, we've never stopped operation. I'm still teleworking from home, but a lot of my coworkers are already back to the office. There's just a flood, a water damage in the building. That's why I'm still teleworking from home, but we are going back soon.
Awesome. Yikes on the flood damage, but hopefully everything will dry out okay.
Yeah, it is. I mean, they're done with the carpet, so we're probably gonna go back to work probably next week.
Okay, sounds good.
Yeah, thank you.
Yeah, and Niati, how are you? Good to see you.
Good, thank you. How have you been?
Good.
So I'm Niti Dokai. I am a professor at George Mason University, and I also serve as the program director of our Veterans and the Arts Initiative, which provides community arts programming for veterans, service members, their families, and military caregivers. It is free of charge. We have been doing pretty well. We pivoted to online programming back in March when COVID first started to affect our lives in a serious way, and we have continued since, and we're looking forward to offering more online programming this fall. So I'll be sharing information about that as it happens.
Awesome. Let's see, Carrie Cannon.
Hello, I'm Carrie Cannon. I'm a prevention specialist with Fairfax Falls Church Community Services Board. We provide mental health services, substance use services, and developmental disability services for Fairfax County. And I believe my manager usually comes, Marla Zemetsky, but she had a conflict today, so I'm filling in for her. And all things considered, we're doing pretty good. Like a lot of people, we've kind of pivoted towards doing a lot of stuff online. A lot of our services and trainings have moved online. Our emergency services for Fairfax County never closes, so we still are seeing people on site, and we still have services available for individuals that need them.
Awesome, and thanks for being here, Carrie. And
Glad to be here.
Yeah, send our wishes to Marla. We're sad she's not here today, but glad you are.
Thank you.
Awesome. Neil Goodman.
Hey, Christy, how are you?
Good, how are you?
Hey, name is Neil Goodman. I'm a Air Force Vietnam veteran. I've been doing mindfulness meditation workshops in hospitals and health clubs for about 26 years in DC and Northern Virginia area. I offer free webinars now. Starting to work with Julie about doing some Blue Star family classes. We tried one already and it seemed to work out. I've been doing webinars for Nova Community College, Lifetime Learning Institute, and also GMU OLLI. I just finished a 3-part session on mindfulness, EFT, and heart math with about, I say about 50 seniors, and they've asked me to come back in the fall and the winter because of just the amount of stress that's out there. But primarily, I'm offering these workshops even on a one-on-one basis, family per family or groups of family, for stress management, incorporating emotional freedom technique and heart math, which is very, very powerful protocols that go along with mindfulness.
Awesome. Thanks, Neil, for the update. And yes, lots of stress out there right now, so I'm sure people are appreciating your classes, your workshops. Let's see, we have a couple of presenters, so I'll start with Jennifer. If you just want to do, Jennifer Mayers, if you want to do a brief introduction. Obviously, we know you'll be speaking here in a little bit, but I want to give you a chance to say hi.
Sure. Thanks so much for having me today. I'm an attorney with Freddie Mac, and I've been with Freddie Mac for about 4 years, not always in our legal department, but before Freddie, I had worked in healthcare and elder law. My family owns assisted living facilities, so I've kind of been immersed in the elder care my whole life. And while I was working within assisted living, I have been helping veterans and their spouses with applying for pension benefits, aid and attendance. And so I approached Freddie about a year ago saying I've been doing these on my own in a pro bono capacity for years. And I think it's something that we could expand to. And they were so welcoming to the idea with enthusiasm, which was great. So we partnered up with LSMV, and I'm excited to present today about some of the services that we can offer to veterans in the community to help them access these benefits.
Awesome. We're excited to have you as well. And then I believe, Brenda, do you want to say hi before I formally introduce you as a speaker?
Sure. Hi, everybody. Brenda Campbell with the In Transition program at Psychological Health Center of Excellence. You'll hear more about that in a bit. I did not serve in the military, but have an affinity for helping those who have served. I've been in the veteran and military space for about a decade. I worked with Give an Hour. I worked with Military One Source. I worked with the Cohen Clinic at Easter Seals, and now I'm with this program. So really excited to be here. And we're doing okay. As far as Defense Health Agency, they are not pushing anybody to go back anytime soon. So most of us are loving the 100% telework. My 14-year-old son is not, but that's understandable. But
absolutely
doing okay here.
Good. Glad to hear that. And yeah, I'm glad a lot of organizations are recognizing the importance of allowing people to stay home right now to keep themselves safe from illness. So good. And we have a couple of folks that called in. So I want to see if anybody wants to unmute themselves and say hi that I missed.
Hi, yes, my name is Erin O'Reilly, and I'm calling from representing the Shepherd Center of Oakton, Vienna, Reston, Herndon. I know that my director, Susan Garvey, was supposed to be on the call, and something came up today, so I'm representing her. I am the new operations volunteer manager, and I'm a military spouse. My husband's active duty Army, and we've been in the area for 3 years, and I am very excited. I just came on board a month ago with the Shepherd Center, and I'm helping them with their veterans help veterans. So really right now it's friendly callers. We have veterans, friendly callers calling veterans that we have found through the Shepherd Center, and the Shepherd Center helps seniors over 50 with delivering food. We have a delivery service where we take food to a senior, and then we also have reopened our driving service for medical appointment and companion shopping, so we can take you to the grocery store or a bank. It was a little tough for us. I was with another Shepherd Center in the area prior, so during the pandemic, the Oakton Vienna Shepherd Center closed services for 3 months with driving, and then we just reopened on June 29th for the stand fair. So yes, so I just want to say hi. I'm happy to be here, and I look forward to hearing the speakers today.
Awesome. Thanks for joining us, Erin. I appreciate it. And glad to hear a fellow military spouse.
Thanks. Yeah, I'm happy to be here.
Awesome. Anyone else on the line that I missed?
Hi, everyone. My name is Kay Larson. I am with a DoD-funded program called Military One Source. I'm still trying to get signed in for some reason. I'm just not able to connect, but if I do, you'll see my smiling face. Military One Source is 24/7 connection to information and referral and support through multiple programming for our active duty, Guard, Reserve, and family members. Thank you.
Awesome. Thanks, Kay. Good to hear your voice. I'm glad you joined today. I also saw that Dee Dee came on. Are you there, Dee Dee? She might have stepped away. Well, thank you guys all for being here. And with that, I want to turn it over to our presenters. And we have first up is Brenda Campbell. And Brenda has worked with us for a number of years and has recently moved over to work with In Transition as part of the Psychological Health Center of Excellence. So I'm going to turn it over to her to provide a more thorough overview of this program that is available for everyone, all of our veterans, active military that are in transition. And so she'll provide a lot more information, but I think it's a great program that we should all be aware of. So with that, I'll turn it over to Brenda.
Thanks so much, Christy. So let me do the boilerplate disclosure first. The views expressed in this presentation are those of myself and do not necessarily represent the official policy or position of the Psychological Health Center of Excellence, Defense Health Agency, Department of Defense, or United States government. I have no conflicts of interest to declare. All right, so let's get right into it. I'm so excited to be with this program. It is part of the Psychological Health Center of Excellence under the Defense Health Agency. And really the one thing I want you to take away from this is that this service is available as a coaching service for anyone who's ever worn the uniform. And the coaching service gets them to psychological health that they need. There's a congressional mandate about this program that I'll talk about in a little bit, but basically we want to try to decrease the barriers to care, especially with service members as they are transitioning. And of course, service members and over your military career are always transitioning, whether you are transitioning out of the military or you are separating or returning from deployment or going to a deployment or PCSing. There's always transitions going on. And so during those times, we don't want anyone to fall through the cracks, and that's what this program is all about. So a little bit of background, our coaches will work with service members and veterans to transition them to and between providers from any healthcare system. So maybe they're working with the military health systems. Maybe they're working with the VA or as a vet center. I actually had the vet center in DC just call me yesterday and make a referral for a couple that were not eligible for their services. And community providers such as yourselves. You're working with veterans in a multitude of capacities, but you may find that they also need some sort of mental health care. And this is what our coaches are able to do. Just to let you know, this is not a counseling service. So it's not telephonic counseling. It is coaching into care. As I said, this program is amazing because there are no barriers. It is free. It is voluntary. It is confidential. It is available CONUS and OCONUS 24/7, 365, available to all service members. So whether it's Guard, Reserves, regardless of the era, regardless of your discharge status or time in service, if you ever wore the uniform for even a day, you're eligible. And there are no limits to the number of times you can use in transition. You might use in transition after coming back from a deployment, and then 2 years later, you decide that you need some marital counseling. You can always come back and use the services again and again. So I'm going to walk through the steps of the services. And the first is the initial contact. And so this can happen a number of ways. You can self-refer, so a service member or a veteran can contact us directly at our 1-800 number, and we can get the coaching started. We will get referrals from mental health providers, possibly. As I said, somebody from the vet center just called me yesterday, but MTFs, any programs that would like to refer, community programs and community referrals. Anybody who's working with a veteran can make a referral. You can give them the phone number, they can call themselves. If you're a mental health provider, you might want to call in with them. That's something that's preferable for us in some cases because we can get more information about what services they really need and what level of care they might need. And then the last is a mandated program, and I'm going to talk to you a little bit more about that later. But in essence, Congress mandated the program at a time when somebody is separating from the military and they have accessed psychological health within 12 months of separating. We're sent their names, and we reach out to them to ask them if they want the coaching program. They don't have to take it, but we will reach out to them and ask because that's something that both the DoD and the VA would like us to do. So the initial contact is pretty straightforward. We really just need the person's name and some way to contact them, either cell phone or email address. Of course, it's helpful to get additional information, but that's all we need to get this process started. So as I said, the service member can decline or accept participation if we are contacting them. Obviously, if they're contacting us, they would be interested in participating. So once that's confirmed, we will set up the coaching services and they will stay with the same coach. Usually they meet weekly, but that's flexible depending on the veteran or service member's schedule. And they will stay with that coach on a weekly or however long basis until they get connected to the services that they're looking for, including psychological health, but we also have a lot of other resources available. So all of our coaches are licensed, they're at the master's level, and they've also been trained in motivational interviewing as well as in military culture. We're really lucky. I just spoke to one of the coaching supervisors last week, and the people that have been there for years. They just love the program so much and they love what they do. Most of them have been there almost since the beginning, which has been about 10 years. So I said, the coaches will address not only the psychological health, but other issues that may come up. We have a whole host of resources available, and probably a lot of you are on our list, as a matter of fact. So these are some of the other resources we provide, folks. These are just the top 6, but obviously there are many, many resources, and we have a huge database of vetted resources available to folks. Now, the Resource Center is available to everyone, including family members. The coaching is not, but the service member is eligible for the coaching, but then everybody can use the resources that we have available. So the coaching ends when someone is satisfied with the referrals that they've received. So they've gotten a referral, they've connected them with the provider, they've seen the provider, they're happy with the provider, then they would end the coaching services. But that's not to say that they couldn't come back into the system at any point. They may see a provider for a month and think, this isn't a great fit. They can always come back and start the process over again. So I'll spend just a minute. I don't need to bore you with DODs and DHAPPYs, but in essence, the DOD and the VA wanted to make sure that service members separating from the military who have been receiving psychological health are automatically enrolled in this program. And by automatically enrolled, they're really just put on a list that is given to us, and we reach out and say, would you like our services? So the mandate really is to make the offer. It is not for them to take the services at all. So that is it. I went through this pretty quickly. These are the resources, how you can connect with us. The phone numbers are there, and our information, including my information. We have a couple of other programs within PHCOE. One is the Real Warriors program, and that is a program that is an anti-stigma campaign. They've got some great resources, including some vignettes and some stories that I would encourage you all to take a look at. Our clinical care team also creates clinical support tools, and what those are brochures and informational sheets that talk about a variety of psychological health issues. They're for providers as well as for clients and their family members. We have materials. I know probably most people are doing things virtually these days, but we do have materials that we can send out to folks. If you're interested, just let us know. And if we ever get back to normal, sort of, I guess, we're always available to do briefings, and we of course can do them this way, or we can do them in person. Any questions?
Awesome. Thanks, Brenda. Yeah, what questions do you guys have for Brenda?
Do you accept a specific client's location, or is kind of open to DNB?
Yeah, no, it's nationwide actually, and outside of the US as well. So we're everywhere.
Okay, thank you.
Mm-hmm.
Awesome. Well, thank you, Brenda. I know, you know, in terms of this resource, you know, especially during this time, we have a lot of military and veterans that may be struggling with mental health. And I know that it can be really challenging as an organization when you're speaking to someone maybe about employment or emergency financial assistance or any type of, you know, crisis type need right now, whether it be food assistance or whatever. I think it's also important that we recognize that it's important to ask the question, you know, how people are doing. Right now, a lot of people are struggling, you know, with finances, or, you know, just getting the proper things that they need. Maybe they're struggling with trying to find childcare for their children, figuring out the school situation that's going on right now. Maybe they're dealing with flooding today from the hurricane. I mean, there's a lot of things that may be going on with individuals, and asking how they're doing and if we can connect them to other resources is really important. And I know it's always challenging to recognize that individuals may struggle with mental health during this time, and how do we talk to them about that, or how do we coach them into care? This is a great resource that we can provide to individuals, especially those that, you know, maybe don't recognize that there may be some mental health challenges that they're having. You know, helping them to recognize that someone can kind of help them understand that it's normal to feel, you know, this sense of unrest and of nervousness of what's going to happen in the future, not sure what's going to happen, going into this kind of unknown space over the next several months as we, you know, prepare for this either second wave or whatever's going to happen. So I think this is really important. And I know that a topic that I'm going to be working on for our next regional community of practice event that I'll be doing in September for all of you guys will be focused on best practices for helping to coach military and veterans into mental health care. So this is a great resource, and I'm so glad Brenda was able to kind of be here today to talk about it. And again, I'll just pause again in case anybody has any questions before I introduce the next speaker. Oh, Bob, did you share your screen?
My screen?
Yeah, it looks like
I don't have a camera on my computer.
it looks like you're sharing your email screen right now.
Not that I know of.
Let me turn it off. There we go. All right.
What I had was a horizontal view of everything that you just made vertical.
Oh, no worries, no worries. I was able to turn it off, so you're good. All right, well, thank you so much, Brenda. And with that, I want to switch over to Jennifer.
Jennifer,
do you want to
share my screen?
Okay, perfect.
Okay. All right, give me 1 second. Okay, can you see my screen?
Yes.
Perfect. Okay. So again, thank you so much for having me today. As I stated before, I have been working in senior care for most of my life before coming to Freddie Mac. And when I was in assisted living, I realized that there is this benefit available to so many people. In the elder care community, we hear it referred to as aid in attendance. Within the actual VA program, it's pension or survivor's pension, but often because people refer to it as aid in attendance, that's probably what I'll say. That's what you'll see on some of our documentation as well. But aid in attendance is just an additional allowance on another VA program. So Christy, I'll send you this information to share with everybody afterwards. Today, what I was going to go over is just the basic eligibility for this program. And then hopefully what we would like is through your networks that you might have people that are eligible, that are veterans needing assisted living, some type of senior care, and you could refer them to LSMV, who we're partnering with now, and they would make the referrals to our Freddie Mac accredited attorneys who can help these veterans navigate the system, fill out the forms to apply for this benefit. So going to go over just what it entails to be eligible. I'm focusing mainly on the typical clients that we serve, which would be somebody who is needing elder care in some sense, and most likely an assisted living. So first, the pension program, some of you might already know a lot about it, and this might be new for others, but it is a tax-free benefit paid to what is considered low-income wartime veterans or their surviving spouse. They have to be permanently and totally disabled. And after you hit the age of 65, you are considered permanently and totally disabled. This is not service-connected disability. So if you are over the age of 65 and you do not have a service-connected disability, you are considered disabled. And again, we often refer to it, you hear within assisted living, elder care community as aid and attendance. So that is not the actual benefit program. So the eligibility for it is for a wartime veteran or their surviving spouse. There are some income limits, a net worth limit as well, and then a medical need component for that additional aid and attendance allowance. Since we are going to be working with people who are at a level of needing an assisted living type of care, we are going to look at this medical need aid and attendance allowance. The maximum that these veterans and their spouses can receive, I have over here. So right now this year for a single veteran, it's an additional $1911. A surviving spouse is at $1,200, $1,228. If it's a married veteran, as long as the veteran needs care, it's $2,266. It doesn't matter if his spouse is receiving care or is not. The maximum that could be awarded would be $2,266. If it is a married veteran, but only the spouse needs care, and the non-veteran, then it's $1,500. So that's the additional income. I have been doing these pro bono applications for 7 years now, and a lot of people I see have this income around $3,000 a month, and assisted living cost, an inexpensive one is probably $4,000 a month. So this additional money, whether it's $1,200, $1,900, really can make a huge difference in these individuals being able to afford the cost of care as they start to age. So let's get into these 4 components and what each looks like. The service requirement, so for this program, they had to serve 90 days consecutive active duty, can't be reserves or National Guard unless they were activated. 1 day had to fall during a wartime period. It is for wartime veterans. This list is not exclusive to all the VA wartime periods, but these are the ones that we are seeing for the clients we're serving in assisted living. Somebody who served in World War II would probably be in their late 90s now. In the Korean conflict, they'd be about mid-80s, and in Vietnam, they're probably about in their early 70s at this time. Discharge, as long as it was not a dishonorable discharge, any other discharge condition is acceptable. I do see a lot of surviving spouse. I would say the majority of the claimants we're serving are the surviving spouse of the veteran. The biggest thing to look for with a surviving spouse is they had to be married to the veteran at the time of their death. I will get calls that say, I was married to a veteran and then I remarried. Is that okay? That's fine as long as the person you were married to when they passed away was a veteran and you didn't get remarried. So they might have not thought about the second marriage being the veteran because it was a shorter marriage. So they just need to be married to the veteran at the time of their death. There are a few exceptions with remarriage. We don't need to get into those, but what we're looking for when they're surviving spouse is that marriage when the veteran passed away and they did not remarry. Medical needs. So for aid and attendance, there is a requirement that the person is so helpless that they need the regular aid and attendance of another person. That's where that phrase aid and attendance comes from. You need somebody there on a daily basis to help you because of a disability. We're typically working with people who are going into an assisted living. So if you're needing to go into an assisted living, there's a medical reason that you're doing that. Often dementia, sometimes it could be other cognitive delays. Some people are going into assisted living because physically they might not have a cognitive issue, but due to their age and physical conditions, they are now using a wheelchair and need another person to help them each day. I put in bold here the one that we're really focused on, that we will frequently see with the clients we're serving, but they must need one of these conditions. So they need that person on a daily basis to help them with things like bathing, feeding, dressing. If somebody's bedridden or spends all day in a bed, they would also meet this definition. A patient in a nursing home meets the definition as well for the medical need. And then if they're blind, and there is a specific definition for what is considered blind under the VA rules, they would meet this as well. But typically, like I said, what we will see is that somebody needs assisted living because of either that dementia, cognitive delay, or physically they can't take care of themselves on a daily basis. Now the next part of, and stop me if you need to, but my plan was at the end after I go through the 4 requirements to do questions. But if somebody is confused about what I'm saying, please feel free to stop me. So with this program, there is an income limit, but it's based on what is defined as your countable income. So I could have an income of $1,000 and qualify, and somebody that has an income of maybe $6,000 a month might still qualify. So the way that we look at what is accountable income to see if you qualify is your gross income less allowable deductions. And so the most often ones that we see are these reoccurring medical expenses, health insurance, health care, assisted living, care contract. That's if you're having caregivers come into your house that you're paying individually. Health insurance premiums like Medicare, burial expenses, and then an independent living facility, which wasn't included as a deduction to your income previously, that has recently been updated in 2018 by the VA. It is very limited, but if somebody were to move into an independent living facility, one of the ones where you have a staff on site, typically they might check in on you every day, you would need a doctor or a nurse practitioner or PA to put in writing that you have to reside in that facility to receive a certain type of care. The facility doesn't have to provide it, and you could be receiving it free of cost from family or friends. But if you do have those limited circumstances where you're in an independent living facility, they might still be able to qualify for this program. And that's different from the way it operated in the past. So now to look at the income limit in a little more detail, because it makes more sense to me when I see it kind of in numbers. And actually, before I get to this real quick, part of the benefit that I found when helping people walk through this program is over the years, I've seen what the VA has come back and requested. So there's some forms that I submit to the VA. They're not a VA form. They're not required under the program rules, but it helps clarify to the representative that is reviewing the claim if the individual medical expenses qualify. So assisted living, which is the most frequent, these are questions that the VA has come back with regularly that I hear from individuals to ask. And that slows up the process. When they're reviewing an application, if they have to come back and ask for additional information, it is slowing an application. So one of the benefits of working with hopefully our attorneys at Freddie Mac, as I've trained them, is these are some of the forms that we will submit with an application that make it very clear. We work with the assisted living to fill this out. I just have made this over the years, but what is the person paying each month for their facility? And some charge daily fees. How much are they expected to pay in the next 12 months? Is Medicaid covering any of this? And these questions right here are from the VA rules. Do they provide supervision because of a mental disorder that make it unsafe if they were left alone? I'm sorry?
You know what? It's like I thought.
Oh, I don't think he was asking a question. Okay, so this is just one of the benefits. We work with the assisted living facilities directly to make sure that we are providing the VA with all information necessary when reviewing these applications. And then, so here, this is just for an example, a single veteran. So often this is about the average income that I see for a lot of people in this age group. So they have a retirement, Social Security, and they might be making around $4,000 a month. Right now, Medicare for most people is $144.60. A lot of people have a prescription plan, a supplemental insurance often, and then assisted living. $4,500 is really not that much for assisted living right now. That is your average expense. So this person, John here, he's spending $4,900 a month, $4,925 on his medical expenses. His income's $4,000. Countable income is your gross income less these allowable expenses, allowable deductible expenses. When I did this formula here, this is not the VA's exact formula. So if people on the phone from the VA and some from the DAV as well will know this is not exact. It's off about 5%. It becomes a little more complex. We'll help our clients go through the complex formulas. But still, it is a little bit easier when you just think of it in terms of your income less your medical expenses. So in this situation, John in assisted living, he's in the hole each month, $925. And if your income is negative, that countable income, then the VA would say he has zero income. His countable income is zero. Now, if he was home and he had a home health care agency coming in, everything else here is the same, except now maybe it's a little less expensive. He's only spending $2,500 a month on his care instead of spending that $45,000. So his $4,000 a month income, and then we're subtracting out these medical expenses he has of $2,925. His countable income, what is left over, is $1,075. So the reason that that countable income is important, and it doesn't matter what somebody's starting income base is the VA, after we figure out what your countable income is, they are going to take the maximum that you can receive and deduct out countable income to determine how much they will pay out in these benefits each month. So when he was in assisted living and John's in the hole each month and his countable income is zero, and this is what I see all the time, he's going to get that full $1,911 from the VA. It's the maximum he could receive each month, $1,911, less his countable income, and that's what they would pay. When he was at home and his countable income was reduced, but he still had that countable income of $1,075, he could get the max of $1,911 less the $1,075, and the VA would send him monthly benefits of $836. So when we're working with our clients for applying for this benefit, what we really want to do is make sure we have included all the necessary countable medical expenses that the VA would consider, because the closer we can get them to zero, or actually to zero, we can maximize how much money they will receive in their monthly benefit award. So that's the income piece. And then lastly, the VA has a net worth limit. Again, in 2018, when the regulations were updated, they made a defined net worth limit. It aligned with Medicaid. So right now it's $129,094. So it's not, even though this is a low income program, these individuals can have some net worth that they have acquired. So we're looking at $129,000. In this, I want to start over here what's exempt. So we're not going to count the value of somebody's primary residence. We're not counting if they have a vehicle, there's no personal property. The VA did include in net worth 1 year of countable income. So if you think back to that single veteran, John, when he was living at home, having home health care come in, we said that his countable income was $1,075. So that in an annual basis is $12,900. So for him, we're including that in his net worth. So his remaining assets, part of his net worth can't exceed $116,000. The other item we're looking at is with net worth, there is a 3-year look back. So the VA is going to be looking at, have you transferred any assets within the past 3 years? That could be something, giving away money to a family member, converting some type of asset potentially into an annuity or trust, anything that would be transferring asset that's less than the fair market value. If there was a transfer at that time, then they do have a penalty that is imposed for anything within this 3-year look back. Because the regulations were not put into effect till October of 2018, even though it is a 3-year look back right now, they're grandfathering anything that took place prior to the regulation change. So it's really only a look back from October 18th of 2018 for now, since we have not hit a 3-year mark since these regulations were changed. And then lastly, share. So this is something that we're going to be sending out within, that we'll be sharing. This is what we want to share, especially in our elder care community. And I don't know why it's not opening. Let's see. Better? There we go. So this is just a flyer that we're going to share, and hopefully you might have people within your clients and organizations that could qualify for this program. And so it just kind of goes over some basics of those 4 requirements, so that they had to serve active duty 90 days. Here are the wartime periods. They need to be over the age of 65 and have a physical or mental condition that requires assistance of another individual. And then the income limits, those are individual, and they'll take into account monthly income and medical expenses. And that's what we can advise them at Freddie Mac if they do qualify. Net worth, again, we'll be looking through all of their net worth documentation, and we'll talk to them to see if this is something that they would qualify for. And then with LSMV partnering up with us, we would have anybody who is interested in this program reach out, and Richard can go into that in a minute, and then they'll take care of referring over to us at Freddie Mac any clients who would be potentially eligible for the aid and attendance pension program. So I know that was a lot of information on this. Are there any questions?
Hey, Jennifer, it's Richard here. I had a couple of questions. If I could give the contact information first, if that's okay.
Oh, yes, that would be great.
Hey, just right now in the beginning, we're just going to be doing this here in Northern Virginia, which you kind of know is down, Leesburg, Loudoun County, down to Fredericksburg, then kind of Manassas down here to Arlington and Alexandria. And you can either contact me at the Veterans Law at lsnv.org or my phone number is 703-778-4809. Only thing I would say is you're going to probably want to, I would say don't wait until they actually need this pension. If they think they're going to need it in the future, they should probably contact us. So if nothing else, we can start requesting all the paperwork they need.
Yes.
And Jennifer, I had 2 questions for you. One is, you're talking about caregivers.
Mm-hmm.
What if you're paying a family caregiver? Would that be a deductible expense, do you think, or no?
It is. Paying a family caregiver is a deductible expense in Maryland. So my background, I'm barred in Maryland and have worked in elder law in Maryland and other states as well. There are Medicaid implications to paying a family member without having the proper contracts in place. So I would just let people know frequently you might want to talk to an elder law attorney about the implications if you needed a nursing home. But for purposes solely of this program, you can pay a family member. You could pay a family member the same amount that you would pay somebody from an agency. So a typical care expense for a caregiver in this area is $20 to $25 an hour. And that is somebody who is just helping with bathing, helping with meals, typically not medications at all. So to pay a family member at the similar rates would be perfectly acceptable.
And then my second question was, which you kind of touched on, is, I mean, I know that there are some situations where Medicaid can get involved to help elderly with nursing homes or whatever. I mean, does this program conflict with Medicaid at all in Virginia, or they complement each other?
So they don't conflict at all. In assisted living is a private pay situation. There's very few that will accept Medicaid long-term care. So for the bulk of people in assisted living, they just don't qualify for any source of benefits from Medicaid to pay for the cost of care. So if we are looking at assisted living, there's no conflict with Medicaid. When somebody does become Medicaid eligible, so if they're in a nursing home receiving Medicaid, at that point, the veterans benefits are reduced down to $90 a month. And it's really who's paying for the cost of care, which government agency, which government dollars. If your income is $2,000 a month before veterans benefits, and you're in a Medicaid facility, most facilities cost about $10,000. You pay your full $2,000 a month to the facility, and then Medicaid comes and picks up the remaining $8,000. They pick up the difference. If you were getting veterans benefits and now you're making $3,000 a month, you're still paying your full $3,000 a month to the facility, and then Medicaid's paying the difference. So what was determined is you can keep that $90 for your own personal needs allowance, but Medicaid's going to come in and pick up the additional cost of care in addition to whatever the individual's income is.
All right, perfect. Thank you.
Mm-hmm.
Awesome. Any other questions for Jennifer about this program?
Yes, I was going to say, Jennifer, would you be able to share with us this flyer that you have right now in the screen?
Yes, so this I'm gonna email over to Christy, and then she will share this. We also want to get out, if you do have any contacts in the elder care community as well, this is where we'll be sharing these hospitals, sometimes within the hospital setting, as people are looking for placement. Somebody had a fall and was living independently, and now all of a sudden they ended up in the hospital and realized they have a social worker there, they can't go home. So this can be something that feel free to share within your networks as well.
Sounds great. Thank you.
Mm-hmm.
I have a question. This is Didi. Actually, I work with a lot of clients that needs placement. And my question is, does this apply to existing client in assisted living that need assistance, or this is prior to placement? I just need clarification on that.
Yeah, so the only issue is we can start, and we would like to start prior to placement. That would be the preference. But for somebody to qualify under that income limit, you have to be able to reduce income by medical expenses. So if they are not paying any invoices yet to an assisted living, and they're not within the facility, then that's where they'll get denied. Often when I know people are looking at being placed, what we do is start gathering all the documents that we will need. And then as soon as they're placed and they're paying that invoice, they get the first invoice, we send in the application. Everything's prepared and ready to go. And the day they're placed is when we send in an application for benefits. I work with a lot of facilities in Maryland, and because I've been working with them so long, they often do agree to reduced rates until people start receiving their VA benefits.
My other question, when you talked about hospital, are you just working with hospital in the area? Because my patients are in Piedmont Psychiatric Hospital, but the goal is to bring them closer to Northern Virginia area. So they're gonna be utilizing the service in the area. So this flyer I'm looking at is very, very good. Is it possible to share this with social workers who are working with some of our veterans prior to discharge so they can start the process? Those in the hospital setting that will be discharging, or how does that work, the process?
Yes, that would be great. If somebody is looking prior to discharge and they know upon discharge the facility setting that they are looking into moving into would exceed their income or reduce their income substantially, then we want to start working with them prior to them needing that care, paying for that care. So we can put the application together, and as soon as they do qualify with that income reduction when they're in a new facility, we can send it in. But yes, we would like to work with the social workers at the hospitals.
Thank you.
Any other questions? Awesome. I think this is so great, Jennifer and Richard, for your work on this. I think that, you know, I just had my grandfather passed away last month, who was a veteran. And these type of benefits can be so helpful to the family that are caring for that individual, to be able to help with the expenses. Because like you said, it is so expensive for home care, $20 to $25 an hour for a caregiver to come in and help with things. You know, my father was taking care of my grandfather, and my father is, you know, about to be 70, you know, and it's hard for him to be able to pick up my grandfather, get him into his wheelchair, help clean him up, get him into the shower, you know, all those things that have been, that as you age get more challenging. It gets harder for the dependents of that veteran to be able to care for them as well. So then they have to seek outside care, and those expenses are going up so much, and it's so hard to be able to afford all that. So benefits like this can really assist with that.
And one last thing to add on what you're saying there, with this program, I often am working with the family member. So it's not typically the veteran or the spouse who needs care who's calling, because typically these people are needing assisted living, about to go into a facility, within a facility, and have cognitive illness. So I would say most of the time, you can refer also the family members, the dependents. So somebody like your dad would be the ones calling us to inquire about the program.
Absolutely. Yeah, and so just for your awareness as well, Legal Services of Northern Virginia is in the network, in Unite Us. So if you do have clients that you'd like to refer over to Legal Services in Northern Virginia, you can either do so directly through the network, through a provider to provide a referral, and it'll go directly to Richard's team, or you can send it to us at Serving Together and we can get it sent over to them. So keep that in mind if you're looking for an easy way of getting those folks connected as well to the right folks. With that, Richard, did you have anything else you wanted to add, you know, in terms of your connection to this and how folks reach out to you?
No, but you know, I worked on this before when I worked at the Blind and Veterans Association, and I think the biggest change is what she's talking about. You could be just in the senior apartments, but as long as you have these medical expenses, you'd be eligible. You don't necessarily have to be in a nursing home. But yeah, we're pretty excited. We think it can make a big difference. And unlike, you know, a lot of the services different organizations provide are very similar to what other organizations provide. And this one I think is pretty unique. I don't know of anyone specializing in pensions like Jennifer and her team are. So.
Awesome. Well, thank you, Richard, and thank you both for joining us today to share more about this program that's available.
Thank you for having me.
Awesome. Well, with that, I want to allow everybody an opportunity to go back around, share updates, announcements, events that you have going on to the group. Obviously, you can also chat them in if you want to use the chat box as well. But with that, I'll kind of just go back through and round robin everybody again in case anybody has any updates they want to share. So I'll start at the top with Bob Bent.
Thank you, Christy, but I have nothing additional to add. They were good presentations and very informative, even for me with my experience.
Good. Well, glad they're here, and I learned a lot too, which was awesome. Maria Jose Cantoni. I got it.
You got it. Well, I just wanted to, we are in your database. So if somebody is interested, or you have a client who's interested maybe to manage, to receive some help managing money, seeing how is the best way to reduce debt, we're here to help. Our services are totally free. There is no requirement. And we can work with the client if they want to do a video conference or they just want to talk over the phone. We can actually provide the service. Again, our information is there. I will put it in the chat as well. So if you have any questions, reach out. Thank you.
Awesome. Jay Kellner.
No, I don't have anything to add. I thank the two presenters. It was a gold mine of new information in some cases for me. And just a reminder, if you come in contact with Vietnam veterans and they don't belong to VVA, tell them about our organization. VVA.org is the quickest way to get in touch with the national organization, and then we would find out about it as well. Thanks.
Awesome. Thanks, Jay. Yolanda.
Hi, good afternoon again, Christy. Those were outstanding presentations. I thank both presenters. It's useful to have the information even when you don't need it yet. And speaking of someone who has a lot of seniors and military service members, veterans, it was really useful. So I look forward to receiving the slide presentation. Easter Seals Veteran Staffing Network continues to deliver Tuesday Talks. The Tuesday Talks were the direct result of the pandemic, meaning we had to figure out useful ways to provide education and training to job seekers. So the Tuesday Talks in July were very well received. 75 was the goal. On average, we had 50 participants. In August, we're going to have Ask a Career Coach. I've sent Christy the information. And in this session, there are going to be colleagues, 4 outstanding career coaches across a broad spectrum of employment workforce development who are going to have discussions. Those are going to be on the 11th and the 25th of August. Again, always lunchtime sessions, so please come and have lunch with us. September, we'll go back to the weekly career coaching sessions. And then, as always, we always partner with other organizations, Blue Star Families, Wounded Warrior Project, Dog Tag Bakery, to provide those virtual workshops that are needed by job seekers. My information is in the chat feature, and more information will be sent out by Christy. Thank you so much.
Awesome. Thanks, Yolanda. Dina San Juan.
Hello again, everyone. I just wanted to reiterate that we are opening again. I'm from the Virginia Department of Veteran Services, a state organization, like I said, helping veterans file claims to the VA. We also do what Michelle, was it Michelle? Oh, Jennifer, I'm sorry, Jennifer and Richard are doing. So services are free, and Fairfax is gonna be open August 10th or face-to-face, although there's going to be a lot of changes. We are not going to do any walk-ins anymore. Everybody should be on an appointment basis, wearing masks and, you know, all the necessary, PPEs and everything that we need to do to in this COVID situation. So yeah, we're opening back August 10, although we are still teleworking. We've been teleworking since the pandemic started, but everyone's now back to work, and we're now ready to do face-to-face meetings with our veterans. Thank you.
Thank you, Dina. Mary Santini.
There. The biggest thing we have right now is free, again, free, resiliency workshops. They are COVID stress management workshops right now, open to anyone with a military affiliation, if you have a family member in the military, you're military, retired, veteran, however it happens to be, these are free. I put them in the chat. There are links. We do ask that you reserve a space so that we know how many people will be attending, but I put them out there for you.
Awesome. Thanks, Mary.
No problem.
Brenda, anything else you want to add?
Sorry, couldn't unmute myself. No, just thank you all so much for taking the time to learn about In Transition. And again, if you have any questions, want to refer someone or want some materials, please let me know. Stay safe, everyone.
All right, thanks, Brenda. Carrie, do you want to add any updates or events?
I don't have any updates or events right now, but I just thank the presenters for their really valuable information.
Awesome, thanks, Carrie. Neati, did you have anything? I know you're planning a slew of events this fall. See if you had anything you wanted to add.
Yeah, sure. Thank you for the opportunity. Thanks, first of all, to our presenters. And I just threw all of my information into the chat. We are going to be offering free guitar workshops for veterans and their families. And we're also going to be providing our songwriting series for military kids as well this fall. So we are about to post that information. We're actually trying to get it up on the website right now, but the website is just taking its time to render. So it should be up very soon. And once we have that up, we will also share the information with you at Serving Together so you can get it out to the network more broadly. But we just want to make sure that people know about it because all of these programs are free for veterans and their families.
Yeah. Awesome, exciting that you'll be doing some more stuff soon. Neil Goodman.
Yes, ma'am. Great presentations, as always, took a lot of notes. I just want to reiterate that I've been with your organization for quite some time, and there's been very few people that have utilized some of the things that I do. I've been teaching in hospitals, in colleges, universities, health clubs for about 26 years doing stress management. So Mary, I know that you're offering through your organization some classes. All you have to do is I'll put my information in the chat, neil9.com, K-N-E-E-L, lowercase, the number 9.com. There's an email link. You can give me some pre-information. But if even, Jay, if you know any Vietnam vets that are interested, I will work on family by family, one-on-one. Most of my GMU classes have had 50 plus participants, and they've been going very well. And if anybody wants to know basically what I do, you can look at one of my blogs is what my clients are saying. And these are evaluations from all the workshops I've done. I've done workshops for Patch Adams at the Gesundheit Institute in West Virginia. I've been around for a while, so I'm just putting it out there. Nobody really has availed my services. This is free webinars on stress management, specifically with the foundation of mindfulness, as you know, Christy, but more so emotional freedom technique and heart math, which I've been also delivering to the STAR program at the Adult Detention Center in Fairfax County. Also have done several workshops like that at USO at Fort Belvoir. I've worked with clinicians at Fort Belvoir, at the Intrepid Center and the Warrior Center, introduced EFT, and very good feedback. So I'm here, but you have to call me. You don't call, you don't get. That's about it.
Sounds good, Neil. Thank you so much. Michelle Palmer. She may be busy. Oh, she said no updates for me. She's got a cranky toddler. No worries. Michelle Cole.
The only update I have is we had our first 2020 graduation of one of our service dog teams, Legend, and his veteran David on the 11th of July. And Legend was the service dog in training that I had brought in to probably our last collaborative that was a live meeting. So they're doing really well. And we're continuing to train our puppies and working with our veterans. So we're really excited about moving forward and just being out and about.
Awesome. Great to hear that, and great for David and Legend. Dee Dee, did you have any updates and things you wanted to share?
I just wanted to say that, just to remind folks that RAF do offer trainings for free as well as consultation to anyone who need those services, mental health training, consultation on behavior, challenging behavior, whichever one. All those services are free from RAF. And I just wanted to thank the presenters. That was really great.
Awesome. Thanks, Dee Dee. I think, Kay, are you still there? Or Erin O'Reilly?
Yeah, I just want to thank the presenters. I enjoyed listening, always learning. And I just wanted to announce to everyone again that we are open for driving to medical appointments and companion shopping, and we're doing food delivery for any seniors. That's open to everyone, and it's a free service, not just for veterans over 50. So please tell everyone that it is there. Thank you.
Awesome, absolutely. And I just have a couple of updates on my end at Serving Together. Some of you probably received the notice, but we're going to be having our in-progress review, or we're going to be calling our in-practice review now that we are 2 years post-launch of the network. It'll be on September 1st from 9:30 a.m. till 12:30 p.m. We're going to be sharing data over the past 2 years of the work that all of your guys' efforts have been in terms of using this network. So we'll be sharing more about that, sharing more updates and announcements in terms of the expansion with Kaiser Permanente and other connections that we've had to other networks in the community. So exciting stuff that we're looking forward to sharing more with you guys about, and just getting your feedback in terms of how the network is going and how we can improve. So again, that's September 1st. I'm also in the midst of planning a whole slew of regional committee of practice events this fall. Planning to start one in September that will focus on supporting veterans with connection to mental health, but then also looking at things this fall that will focus on suicidology, as well as just overall collaborative networks in terms of helping prevention. So fun things that are going to be coming in terms of our regional community of practice events. So be looking out for those as we get those set up. A couple of other things that we have going on. We are currently hiring for an AmeriCorps fellow. So if anybody has individuals that are looking for work, we do have a position that we are currently interviewing for within the Serving Together team. And we also are seeking interns for social media and data analytics if you have folks that are looking for internships. And upcoming collaboratives in Northern Virginia, just so you guys know, the Loudoun CVED meeting has been pushed back 1 week. We're going to start pushing them back to the third Tuesday of the month, starting at 7 p.m. So our next one will be August 18th at 7 p.m. We are going to start doing elections for the executive committee for the Loudoun CVED. So if anybody's interested in running to be a part of the leadership team of the Loudoun CVED, please let me know. We also have the Belvoir Collaborative coming up on August 20th at 12 p.m. We have Operation Gratitude, and that will be presenting along with another organization that is slipping my mind right now, but encourage you guys to participate in that if you're interested. We also are launching a DC collaborative. We're going to be starting out with a series of town halls. So for those of you that are interested in connection to resources and organizations in DC, that next town hall will be September 2nd at 1 p.m. And yeah, so we have lots of stuff coming up, lots of virtual things coming up, tons of collaborative meetings. So we encourage you to join any of them. lots of resources and information to share. So that's it on my end. Is there any other individuals that I missed that have updates, announcements they want to share before we close out? All right, I'm seeing thumbs ups and some clapping, so that's great. Thank you guys all for joining today. I will be typing up, getting the notes sent out to you guys along with the recorded meeting and the slide decks from the presenters. So thank you guys all for your time today. Our next meeting is October 6th from 1 to 3 p.m. So we'll look forward to sending out the Zoom invite for that, and we'll see you then. Have a great rest of your day.
Bye, everyone.
Thank you.
Bye-bye.
Bye, everyone.